have a regenerative treatment, bear in mind that what's happening is you're going through all the stages of repair and healing that you would go through naturally. So when a patient comes to our office, we draw your blood, we process that in our lab into platelet rich plasma. That takes about 30 minutes or so to be processed, and then we're usually ready at that point to treat the patient. Once the patient is in the room for the procedure, we basically use a combination of fluoroscopy, ultrasound, palpation skills, different testing techniques and abilities to land and place the regenerative solutions at the areas that need to be repaired, and you do them safely so that we get a good response to get the tissue to heal. Generally speaking, it's a matter of getting through the next day or so. People are going to feel sore and achy and swollen. My experience has been generally about dinner time the next day, the patient's usually over most of that reaction. So about 24 to 36 hours of kind of a achy, sore storm. And then the storm passes and people typically start to feel back towards normal within a few days, and commonly about 1 to 2 weeks out is where most people start to feel that significant improvement, where the shoulder is feeling better, the motion is improving, they can reach up further, their knee is less painful, they're able to go up and down the stairs, and commonly that actually gets better and better and better for about 4 to 6 weeks and even several months.